The U.S. Senate is debating the big ugly bill, which would cut $1 trillion from our healthcare to pay for tax breaks to the rich. Welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202-838-6837, and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's show. In today's episode, healthcare expert Alex Lawson from Social Security Works returns to give us the latest news about the bad budget bill and what happens next. So welcome, Alex Lawson.
Thanks for having me.
So even as we speak, today, Monday, the Senate is in the process of Voterama on this terrible budget bill. So tell us what's going on.
Voterama is the stupidest part of the stupidest process in the, stupidest piece of our government. It really is a sight to behold because it can't really accomplish anything that the Republicans don't want, because at the end they could just wipe the slate clean. So it's just this big piece of theater where the Senate Republicans and the Senate Democrats just add all these amendments, but it can only make things in the direction of the party who is in power, which in this case is the Senate Republicans. So what it looks like right now is the Senate Republicans voted it's called the motion to proceed, but it's the first vote. So yes, there could be some difference in the final vote after this Voterama process, which really is just to create a lot of drama. But it's likely to mirror the original vote, which means that the Senate is likely to pass their version of the big, beautiful betrayal. I think everyone is tripped up more by how to describe this bill than anything else. But it is a deeply immoral document. I think the magnitude is not well understood yet. You said $1 trillion, $1.1 trillion, over $1 trillion in Medicaid cuts alone. You can't do that by nibbling at the edges or something. $1 trillion is a stake through the heart of Medicaid. This is a program that serves tens of millions of people and seniors, children, mothers giving births. This is a program that serves the American people. 1 in 2 people in nursing homes paid for by Medicaid. And so you have 17 million people across all Medicaid, ACA, everything losing their health care, so that you can give trillions of dollars in tax handouts to a handful of billionaires, so that the Republicans can do that. And then those billionaires will reward them with campaign cash. But even if you're not the one who specifically loses your healthcare, right? It's like, sure, it's going to cause a rural hospital collapse, which it is. But you have people who are like, yeah, but I don't live in a rural area. What's it going to do to me? And you're like, well, where do you think everyone who doesn't have a hospital anymore is going to go to? Or if your loved one is in a nursing home or might need 24-hour skilled nursing care or just skilled nursing care, they're not on Medicaid. What's it going to do to me? Well, if the other person in the 1 and 2 in your nursing home loses their Medicaid funding, that nursing home goes away, right? So we have the numbers. Hundreds of rural hospitals gone. But every single hospital will be impacted by the people moving from those rural hospitals, driving the 4 hours to your hospital. So if you're lucky enough that your hospital doesn't close, it's just that the quality of care you receive in your hospital is going to plummet. Hundreds and hundreds and hundreds of nursing homes across this country are going to close. But even if you are lucky enough that a nursing home that you, a loved one, or that, you might need someday doesn't close. Well, guess what? The quality of care in all of the nursing homes is going to crater. And anyone who's dealt with this system with their parents or loved one, whoever, knows that the starting point was a disaster, with private equity already hollowing out and financializing or making it about extracting a profit and not delivering care. That's before this bill, kicks the stool out from under both nursing homes and hospitals. So the magnitude of it, I think that David Dayen, he wrote a piece in the American Prospect titled "The Republicans Propose a Hospital Apocalypse." That piece, I think, gets the magnitude correct, that this is something that nobody has seen in this country. Nobody has seen the Republicans just rip healthcare away. They've proposed it many times, and we've fought it and defeated it, and we still could defeat it in the House. But last time it was Senator John McCain's thumbs down. I don't know if there's going to be anyone who shows that sort of bravery. What we did see is Tom Tillis voted against the motion to proceed and then abruptly announced his retirement, because that does seem to be one of the only paths. If you're a Republican lawmaker, you're more afraid of Donald Trump and his minions than you are of your constituents. You want to serve Republican billionaire donors more than your constituents who put you in office. So you have Susan Collins in Maine, who is, possibly a name that's thrown around that might vote against this in the final telling. I don't know. Lisa Murkowski, she got bought off. I'm calling it the Klondike kickback. There's specific things in the bill that are just cash transfers to Alaska. That's clearly why she voted for it. A lot of that got stripped out by the parliamentarians, so maybe her vote will change. I doubt it. I think we're going to see I think we're going to see the same vote in the final vote as we did in the motion to proceed, because I actually do think the Senate is also throwing this hot potato over to the House, because they don't want to be the ones who deliver the thumbs down to Donald Trump. So they're throwing it over to the House, which has a narrower margin than the Senate, which is very rare. The House, they can only lose 3 votes, and they're already down. I mean, it depends on if you believe them or not. They're already down more than 3 votes. So it moves over to the House if it passes the Senate, which would likely be in the early morning, like 1 a.m, 2 a.m. on Tuesday. And then they're saying they're going to move it as quickly as possible, and that the House would be aiming to hit the July 4th deadline for the president to sign it into law. But the House is riven by factionalism. The Freedom Caucus has already said the fact that this explodes the debt is a line that they're not willing to cross, that the Senate has, made it even a larger explosion of debt. And that's sort of on one side of the House Republican caucus. And then on the other side, the Republicans who are saying the Medicaid cuts are too big, they're saying the Senate has made those worse and they can't vote for it. So we have, and I think your listeners have, a real opportunity. First, we are going to go down swinging in the Senate, and who knows, maybe Susan Collins, Lisa Murkowski, and will join Tom Tillis in deciding that it's not best to be remembered as the senators who, killed their constituents for tax breaks for billionaires, and instead show a bit of bravery. I'm not holding my breath, but that could be. The classic Republican move is the Josh Hawley, and we should probably try to coin that as a term. Oh, don't worry, he's just pulling a Hawley, which is to pretend that you're a decent human being to mask the fact that you're just a sociopathic, power-hungry nihilist. This is a guy who said, oh, well, this is going to cause a rural hospital collapse. There's going to be no more hospitals in Missouri. And that's true. So he was right, and nothing changed. And he's like, oh, okay, fine. You can have my vote. The man is a slug. Actually, that's unfair to slugs. They have more backbone than Josh Hawley does. But I predict most of the senators are going to pull a Josh Hawley. I think in the House, there are, I just heard a CNN segment that went over, I think it was 5 polls that had the net negatives of this bill now between 20 and 30%. So it's deeply unpopular, and it's only getting more unpopular as people know about it. And so, yeah, I think it is very possible that we could scare up a few more no's in the House.
Mm-hmm. Well, over 70 million Americans benefit from Medicaid directly, and there are not 70 million billionaires that get tax breaks. So it's pretty clear why this bill is so unpopular. And I just want to highlight something you said. People may not realize they are serious, and they can seriously threaten, demolish our healthcare system. Just because we were saved at the last minute in 2017 by John McCain's thumbs down vote, people may be expecting at the last minute, somebody will solve this, somebody will fix this, somebody will make this not so bad. They couldn't possibly be steering the Titanic directly into the iceberg and cheering, right? But this was this whole same idea that our rights to abortion healthcare were going to be protected just because we had them for decades, and because millions of women were, did not have to have back alley abortions. And in fact, a representative from Florida had a miscarriage and had problems getting an abortion, and she's one of the people that voted for this, that chose this. So people may feel like nobody would really pass something so terrible, but I just want to remind the audience, yes, they will. That if we don't stop them, they can and they will wreck our healthcare system. So we can't rely on the fact that we've been saved in the past, that various terrible things that have been thrown around got taken off the table at the last minute. We can't rely on that. So you mentioned this week is the important week, that in the next couple of days, the Senate is going to vote. And if it gets through the Senate, it goes back to the House. So what can or should people be doing right now?
Calling your senators. I mean, especially if you live in Alaska, in Maine, in North Carolina, just in any of these states where you have a Republican senator who might possibly vote no, call them. You can call their district office and their district offices and their DC office twice a day, once in the morning, once in the afternoon. That all counts. And don't ever listen to the people who say that that doesn't matter. That sort of form of, don't try nihilism is, I think, even grosser or more bland than the straightforward, bloodthirsty nihilism of the Republicans who are willing to kill people for money. Of course, we have to fight back. Of course we do. That's how we differentiate ourselves from the perpetrators of this. And we have to do everything that we can to split some Republicans off this vote. So we are running some analysis right now on the nursing home numbers and showing, we've got 3 districts in Iowa and the state of Iowa where you have these Republicans who you could tell them, like, you got to vote against this because you have hundreds of beds, nursing home beds in your districts that will disappear if you vote for this. And the people will not accept that. and, or across the state in the case of Joni Ernst. So it's really about telling the Republicans that you're watching. But you also should be telling your friends and family exactly, Laura, what you led in with, that this is real. This is happening. I call it the decency trap, and it's sort of like adorable, but it also is a straight line to fascism. So it's not that adorable. But I believe a ton of Americans are like, they're pretty decent people. And so they're like, I can't be that bad. No one would really increase the deaths per year by 51,000 people per year. That's a Yale estimate of deaths that would not have otherwise occurred if this bill passes. A lot of American people are like, oh, yeah, I don't think that anyone would really do. Yes, they do. They do it. And then the other thing, and this is one of the more annoying parts of working in advocacy, we ring an alarm bell and we stop bad things from happening. And it sort of makes people be like, oh, well, see, you're always saying those bad things are going to happen. And then they don't. And you're like, right, because we defeat them. But we have to win 100% of the time. To stop the bad things from happening, we have to win every single time. But if you're just looking to burn down the system, you only have to win once. And that's what they're aiming to do. They know that too. And they know that with a significant cratering of healthcare quality and quality of life for every American, because remember, we're only talking about one aspect of it, right? Nursing home collapse, hospital apocalypse, 17 million people losing healthcare. That enormous badness is still only one part, because they're also stealing the food assistance off the plates of the hungry, right? For example, that's just one of the other pieces that's in this remarkably evil piece of policy. So we have to fight. The way that we fight is by raising our voices, by calls, by visiting our elected officials, but also by talking to our neighbors and getting organized and raising our voices together and fighting this in every way that we can. And that is the path forward. The bill is deeply unpopular, so don't believe the propaganda cannon. That they're going to get this big win. They're going to get this big. Tom Tillis, the guy from North Carolina who voted no and then abruptly said he had to resign from politics because, he's scared of Donald Trump and his minions. But Tom Tillis, before that no vote, he said these Medicaid cuts are going to be a disaster for Republicans for years to come. And that's the reality. They're going to get this. If they get this across the finish line, it will be the dog who catches the car. They don't know how they're going to go back. I want to watch them try to defend this back in their district. It starts deeply unpopular, and as soon as it starts killing people's family and their neighbors, it'll just get more and more unpopular. And we just have to make sure that everyone knows who the perpetrator of this violence is. It's the Republicans in Congress doing the bidding of Donald Trump, the Republican sitting in the White House.
Well, thank you very much for that, Alex. And for everybody watching, now is the time. Pay attention, because this is crunch time. This is where it is going to pass or fail, is this week. And now we're going to answer some of our viewer questions with Louise Norris of healthinsurance.org and Diane Archer from Just Care and Social Security Works. So let's start with Louise talking about a marketplace rule that got finalized recently and how this is going to affect people with their health insurance.
Absolutely. In addition to all the stuff Alex was talking about with the budget legislation, we also had the proposed marketplace rule that HHS had proposed earlier this year got finalized recently. So it takes effect August 25th. Some parts of it take effect right away at that point. Other parts take effect for the 2026 plan year. One part that did get a lot of media coverage when it was first proposed was making open enrollment shorter for self-purchased health insurance. They ended up pushing that one out a year. So the open enrollment that starts this fall on November 1st will still go through January 15th in most states. The process of shortening that and making it end on December 15th instead, they push that out to the fall of 2026. But the things that will take effect right away in August, unfortunately, people who are DACA recipients who gained access to the marketplace last year will lose that access starting August 25th. And unfortunately, it won't even continue to the end of the year. They will be removed from their coverage right away. Unless they have access to an employer-sponsored health plan, unfortunately, they will generally just be uninsured. That's about 10,000 people. Another provision that takes effect right away on August 25th is the low-income special enrollment period will end temporarily from August 25th through the end of 2026. So it'll end for 15 months or so. This is a special enrollment period that lets people with low incomes sign up for marketplace health insurance anytime they want throughout the year. They don't have to only sign up during open enrollment or a special enrollment period related to a qualifying life event. Instead, for the last few years, they've been able to sign up anytime. So that is going away on August 25th. So for a single person right now, that's an income of up to about little over $22,000 a year. And you do have to earn at least the poverty level, which is about a little over $15,000. If you're in that range and you don't have health insurance, now is the time to sign up, because after August 25th, you will no longer have that year-round opportunity. You'll have to wait till open enrollment. Starting with 2026, unfortunately, out-of-pocket costs are going to be higher as a result of this bill. They did finalize a provision to change how that number is indexed each year. So maximum out-of-pocket costs, the maximum allowable number is going to grow to $10,600 for a single person next year because of this final regulation. They're also going to require more documentation for eligibility for special enrollment periods and for income. If you attest to an income that doesn't match what they have in their system from the IRS, you need to be prepared to provide proof of your income. So all of this stuff is going to be explained to people in the notices they get from the marketplace and from their health plan as we head into open enrollment, but it is just really important that people pay close attention to all of those notifications.
Thank you, Louise. And just a reminder, we're talking about open enrollment for the Affordable Care Act insurance marketplace. And Medicare annual open enrollment period begins on October 15th and ends on December 7th. But you can always enroll in Medicare in the 3 months before the month that you turn 65 and the 4 following months. If you sign up in the 3 months before you turn 65, your coverage begins on the first day of your birthday month. Diane, can you talk about who under 65 is eligible for Medicare and how do they enroll?
Sure, I'd love to. So a nice element of Medicare is that people under 65 who have a disability and who are receiving what's called Social Security disability insurance are eligible for Medicare. Unfortunately, most of them are not eligible immediately. They need to wait 24 months plus another 5 months from the time they're eligible for SSDI, or a total of 29 months from the time they become eligible before they can get their Medicare benefits. There is an exception. People who are under 65 have no waiting period if they have ALS or if they have end-stage renal disease. And then for enrolling in Medicare, you need to either go to your local Social Security office, call Social Security, or go online to Social Security, which is the easiest way to go to enroll. And if you have SSDI, Social Security Disability Income, you should be able to enroll easily.
Thank you, Diane. And speaking of dental or vision insurance, is it better to use the Affordable Care Act Marketplace, an unregulated online insurance shopping website that might compare different plans from different providers, or go directly to providers' websites to see what they offer? And marketplace plans for vision and dental are also only offered during open enrollment, right? This is for Louise.
Yes, that is correct. So standalone dental plans are available in every marketplace, every state's marketplace, but in most states' marketplace, there is no option to buy a standalone vision plan. So in most states, if you want vision insurance, you do just have to go out on the open market. You're not going to find it on the marketplace. With dental, you can get it in the marketplace during open enrollment or a special enrollment period. You can't just buy it anytime you want. And if you're in a state that uses healthcare.gov, you can only buy dental insurance if you're also buying health insurance. So you can't go in and use it just to buy dental insurance. Say, for example, if you have health insurance through Medicare or through an employer and you just need dental, you can't use the marketplace for that. There is an option to buy dental or vision out on the open market. If you do that with dental insurance, you will not get the ACA protections that go along with pediatric dental. So pediatric dental under the Affordable Care Act, they cap how much out-of-pocket cost you have for your kids' dental care, and then there's unlimited benefits from the plan. That is the opposite of how it works for adults. For adults, the plan caps how much they will pay, and it's a fairly low amount. On most plans, it's between like $1,000 and $2,500 for the whole year, and the plan won't pay anything beyond that. If you buy your plan out on the open market, it's going to be that same way for children as well. So the only way to get the unlimited benefit coverage for kids is to get your dental plan through the marketplace, which again, you have to do during open enrollment or a special enrollment period. But if you're looking for dental for an adult, you don't get any special protections by buying it through the marketplace because the Affordable Care Act doesn't provide any adult dental rules or provisions. Like I said, the benefits are fairly low, and there is no cap on out-of-pocket costs for adults. So you can check with your dentist. Some dental offices have memberships that actually end up being for some adults, since you know your total benefit on a private plan would be capped. Depending on what you need as far as dental care, you might find that your dental office provides a membership plan that actually ends up coming out ahead. In other people's circumstances, they'll find that buying a private dental plan is the more cost-efficient way to go.
Thanks. So we just covered what to do for dental and vision. If you are not on Medicare, Diane, can you talk about what other options there are for free or low-cost dental and vision benefits?
I'd love to. Yes, there are options, whether you're on Medicare or not, for free and low-cost dental and vision benefits. Your best bet is starting with what's called a federally qualified health center. There are thousands of them across the country, likely one in your community or near your community. Sometimes they're called community health centers, and they often will provide free and low-cost healthcare services, and sometimes they'll provide dental and vision benefits. So start there. You can find out where your nearest community health center is by going to findahealthcenter.hrsa.gov. That's findahealthcenter.hrsa.gov. For free or low-cost dental care, you can also contact your local dental school. Sometimes they offer programs for their students that are quite good. The Dental Lifeline Network is another option. That's a national not-for-profit organization. Again, the Dental Lifeline Network, you can find them online. In addition, needymeds.org is another nonprofit that provides information on free and low-cost dental clinics. That's needymeds.org. So you can go there to see what's available in your community. And then for free and low-cost eye care, check out Eye Care America. That's EYECARE America. And you can find them online at www.aao.org/eyecare-America.
Thank you, Diane. And thank you, everybody who joined us today to learn more about this budget bill and cuts to our care. Please text or call in your health insurance and healthcare questions to us at 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.